So welcome everyone to the Equity, Diversity, Inclusion, and Intellectual Freedoms Lunch and Learn session, Support for Those in Poverty. I am your host, Roxanne Pico-Lenz, and I am the chair-elect of the EDII committee for this year. Before we get started, I am going to read this disclaimer. So if you did not register for the Zoom, I have to kick you out. So please make sure that you change your name or type in the chat if you're using a different Zoom account than the the name that you registered under. So, and here's an accessibility slide. So there's closed captioning if you need it. So you are going to get a continuing education credit certification afterward. And also I will be adding a evaluation link onto the chat, and you're also going to get it by email. So if you don't mind filling that out after the session, that would be really helpful. The last 10 minutes of the session will be reserved from questions for the audience. So let's introduce the panelists. We have Jennifer Lindsay here today. Jennifer is the branch manager of Parker Memorial Library in the Southern Oklahoma Library System. She has been the project manager for 2 libraries transforming communities, focused on small and rural libraries initiatives, one engaging the deaf community and one on resources on homelessness. We have Raegan here today as well. Raegan Mach is she in her current role at Parent Promise. She connects with community members, organizations, and agencies to raise funds for Parent Promise's life-changing parent education programs that prevent child abuse and neglect throughout the OKC Metro Area. And we also have Karen Knapp. Karen is a behavioral health case manager who works for Family and Children's Services in Tulsa. Through a grant from the Zero Families Foundation, Karen provides case management services for library customers. She has been in the social services field since the 80s and has mostly worked with people who have little to no income. All right, so we'll get started with some questions here. Okay, so ladies, please introduce yourselves and the work you do to support those in poverty. Would you like me to? Yeah,
I was about to say, I can go ahead and start. I didn't know what order we needed to go in. Hi, my name's Raegan Mach. As Roxanne mentioned, I'm the Community Relations Director at Parent Promise, and we're also the Prevent Child Abuse Oklahoma chapter. I've been working to address poverty in my work, as well as just in my free time, I would say since I was even in high school. You see, I grew up in a very low income family of a single parent, and we were not strangers to food scarcity or financial instability. And I just decided at a very young age that I wanted to do everything I could to support people who were having experiences such as I. So since then, I've completed over 1,000 hours of community service with different nonprofits across Oklahoma, as well as in my professional work. I've worked for organizations such as Regional Food Bank of Oklahoma, Girls on the Run, and now Parent Promise.
Okay, I can go next. My name is Karen Knapp. I'm a behavioral health case manager. So I am providing case management services in the library system. Most of my work I've done with people who have no income, who are homeless. That's been my focus for the past 10 years. So I'm providing services for people that come into the library. They need to access resources. They need to find housing. They need to apply for Social Security, things of that nature.
Okay, so I'm Jennifer Lindsay. I'm the branch manager of Parker Memorial Library in Sulphur. So I've had some of my own experiences with poverty, and so it's just been kind of an issue. It's gotten close to me, but then with COVID, I started seeing an uptick, even at my small rural library, of homeless people who are struggling with homelessness or poverty and needing different services. So I ended up applying to ALA for a grant, which we used to just kind of figure out what we could do to help. Being a small community, rural poverty can look a little different than it does in a big city. So just figuring out what we might be able to do as a community.
Right. Okay, so I have a question. So what is one surprising thing you have learned in working with people living in poverty? And are there any common misconceptions that you would like to speak to?
I could start. A lot of people who are experiencing poverty, one of the surprising things I learned is that they can navigate a lot of systems, like the bus system. If I had to ride a bus, I'd be having to ask everybody around, what do I do? What do I do? They can find food banks, utility assistance. A lot of them are so resourceful. They just might need to know what resources are out there and how to access them.
Perfect. I second Karen on that. I find that people experiencing poverty are very resourceful, as well as a common misconception I feel that mainstream media can perpetuate is that people who are in poverty are lazy or they've somehow chosen to be in the position that they're in. As a person who grew up experiencing poverty, this truth was, or I guess misconception was not necessarily surprising to me, but it's incredibly false nonetheless. I would say 99.9% of people who are experiencing poverty are due to what I term root causes. These root causes can be their social status, their geographical location, underemployment, undereducation, lack of housing or healthcare, even their health conditions. Very, very rarely do people stay in a low income status out of an unwillingness to work.
Yeah. Well, I was thinking off of that was also like, it wasn't so much, I wasn't surprised so much by what I saw from the people I was trying to help. It's been other people who are like running our local nonprofits and things, having so many misconceptions about how if you help too much, you're enabling them to just stay in poverty. And that's just not the case. No one wants to not have a roof over their head. No one wants to go to bed hungry. And so, yeah, that's like the biggest misconception I see around here is like, no, we need to help people because we should help people. That's really all there is to it.
I once read a book that had a really good line. It said, people expect others to pick themselves up by the bootstraps, but some people never had boots to begin with. And I thought that was really powerful.
I love that.
Well,
Yeah, I love how people say, why don't they just get a job? And I can go on and on and on about the reasons how that's very difficult and challenging.
Yeah.
Definitely. I mean, how do you get a job without having, a phone or access to email, or I mean, there's so many
Clean clothes, transportation.
so many different barriers. So what is one surprising thing that you have learned in working with people living in poverty? Wait, I just asked that, sorry. What is your working definition of poverty? In your experience, what are some of the impacts of living in poverty for an adult, teen, child, or family?
My working definition of poverty is having no income or having little income, which may not meet or barely meet the cost of basic needs. And I have all kinds of stats on poverty in Oklahoma and stuff, but the impacts, generational poverty, discrimination, limited access to medical care, education, safe housing, and basic needs. People that are homeless or experiencing poverty often experience people being assaulted, being stolen from, being targeted, might have chronic stress, health issues, poor or substandard living conditions. to name a few.
My working definition of poverty is fairly simple. It's just the inability to self-sustain a person's needs. So the needs can be food, housing, healthcare, toiletries. Like, for some reason, I feel as a society, we've ingrained this idea that needs are just food, shelter, water. But I think as human beings, we know it is so much greater than that. And so for me, people who are living in poverty, that even extends to people who are completely reliant upon government assistance, such as Sooner Care and SNAP. And the impacts of this affect the entire person as well as the entire family unit. It affects their mental health, their physical health, their emotional health. Just from the stress of financial instability alone causes long-lasting detrimental impacts. But I think one of the most significant contributors is just a lack of access. It's a lack of access to more nutritional foods, cleaner housing, safer neighborhoods, private education or tutors, reliable transportation. There's just a lack of access to so many necessities that can improve a person's quality of life. And poverty in and of itself can affect an entire person as well as their entire family unit.
Thank you, Raegan.
Okay, yeah. So I have a much similar definition to what's been said. It's just, struggling to access those basic needs to like really, function in our society as it is. And then one of the big impacts is just there is a trauma to being without, especially if you see others with stuff, or if you're, if it's affecting other parts like your health, like being, we had that cold spell, and being outside in that would not be good for anyone.
Mhm.
And then also just the impact of some of the shame and judgment that can come from the community. Because we've had some issues here where it's like, you have some entities where like, oh, we need to watch out for that person because they're poor and we think they're up to something. And it's like, no, those things don't actually go together. And that can have an impact on someone. Like, that's definitely not a healthy thing to be subjected to.
No. Stereotyping is so dangerous.
Mm-hmm.
According to the article I read in the journal record on 12/19/22, 70,000 children are homeless in Oklahoma. Just put that out there.
Mm-hmm.
That is a lot higher than I would have thought. My goodness, that's terrible.
Mhm.
So what are some of the greatest areas of need you have seen through your work and or in the state of Oklahoma?
Greatest needs that I've seen: access to healthcare, access to safe and affordable housing, transportation, barriers to employment, computer literacy. I've worked with so many people, older people, they might not, they'll come to the library to use the computer, but might not have any knowledge. And you're trying to sign them up for something like Medicaid, or they have to have an email address, but they don't know how to access it, and you have to like build them a whole thing just to get a benefit that they're entitled to.
I +1 all of the areas that Karen mentioned, as well as I see it more significantly in the rural areas of Oklahoma. I personally grew up in rural Oklahoma, but I currently live in Oklahoma City. And I grew up in a 1 mile by 1 mile town with one stoplight. The only social service we had was a church food pantry, and that was it. And after moving to Oklahoma City about 5 years ago, I realized just the number of resources in larger metro areas and just how many social services were available compared to these smaller rural areas. And for myself, I've said that as a long-term goal is to help build and make more accessible social services to rural areas that have more limited access.
Okay. Yeah. So to go off of that with like the rural areas, I was kind of surprised by the things I realized, like, because like, you understand why there wouldn't be a lot of nonprofits here when there's only 5,000 people to begin with. You can understand why people aren't opening offices here. But in order to get to some of the things, there's a lot that's needed. Because, like, there's a lot of, well, there's certain services that we have. Like, you could probably find a hot meal at a church most days of the week around here. And you could probably find someone's like backyard or garage or somewhere to stay. Couch surfing is very much a segment of rural homelessness. Because you are still homeless because you don't actually have your own address. And so the things we really realize that are like kind of surprising, there's no public shower. We are far from the interstate. Most, in the highway that runs through town, I mean, people are coming to the national park. There's not like a truck stop where someone could go and pay a couple bucks to get a shower before a job interview. Or just to, or going, a kid needing to go to school. Like, there's nowhere to clean up. The other thing is transportation, because people, some of our more middle-class people are like, there's a shelter in Ardmore, there's a shelter in Ada. It's not that far. But it's a long ways when you don't have a car. There's no public bus system. There aren't taxis. There's not any way to get the like half an hour to any of those towns to access those services. And then just the digital aspect of it. Because that's why people started coming here anyway to the library, was because we have the Wi-Fi, we have the computers, and so many of the services want people to get online in order to access them. So there's because there's things that are based in our neighboring bigger cities, but they don't necessarily have workers who come out to Sulphur. And so they have to be accessed online, and we're pretty much the one place to do that.
I think of, sorry, Roxanne, I was just going to add, one of the other barriers I've seen, and it goes into the part that Jennifer and I mentioned about rural areas, is if you are able to somehow locate information for an organization that might be able to help with rent utility assistance or whatever type of assistance it is, there's oftentimes a geographical area they're only allowed to serve, zip code limitations, things of that nature. And those are often a lot more restrictive because of things like grants and funding. And so, for example, if I'm out in my hometown of Tonkawa, Oklahoma, I couldn't call the Salvation Army in Oklahoma City and ask for rent utility assistance because they only serve Oklahoma County. And so there may be these wonderful large organizations, but they're just as limited in their ability to serve as I am in my ability to access.
Not even something that had crossed my mind. So in your town, there's nobody who can help because you're outside of the county of, wow, that's awful.
Ironically, though, I would say I ran into the opposite issue of realizing that organizations down in like Ardmore or Ada were including Murray County in their grant applications, but they weren't up here doing anything with it. Like, they weren't actually spending any of their resources here. So that's one of the things that we're still kind of struggling with to navigate.
All right, so I'll move on to my next question. In your experience, what are some helpful resources or policies an organization such as a library can offer, and what are some unhelpful resources and policies?
What I really appreciate about the libraries, they offer access to computers, but a lot of people need computer training classes shown how. Libraries can be helpful if you have the staff. This is a big thing, and this is what I do, is filling out applications and forms. A lot of people, you have to go online and fill that out. And also information and any community resources, which in rural areas, that doesn't sound like much. Unhelpful, and I don't know how this works for everybody, but like in our library system, if you want a guest pass, you have to have an ID. Well, if you happen to be homeless, your ID is going to be stolen. I mean, that's just a given. And so, you know, maybe make exceptions for people that just want to apply for Social Security or something, not watch videos, that type of thing. And also, no access to a phone. I don't know, like in the Tulsa City County Library system, I'm the public phone. We don't have a public phone. There's no way like where somebody could call Social Security, which takes at least an hour, and, you know, go on. Mm-hmm. And then another, because I'm really work a lot with the homeless, there's no sleeping allowed in the library. And a lot of homeless people will come to the library because it's safe and fall asleep because they have to sleep with their eye open all night, especially if you're on the streets.
Yeah. I think for myself, the three most helpful resources or policies I've seen has the first is hosting a DHS embedded worker on site. A lot of organizations have started including this, and it's basically where a Department of Human Services worker is scheduled to be on site at your location so many hours a week. It is a free service the Department of Human Services has started doing, and those DHS embedded workers can help community members apply for SNAP, Sooner Care, TANF, child care subsidies, all of that. So they walk through that process with them. They're on site, and that's just such a hard barrier for people to navigate already, but it's a necessity for almost everyone in poverty is to access those resources. So having somebody at the library who can help them with that is essential. The second is hosting free extracurricular activities for children, but also older youth and adults, robotics clubs, book clubs, fitness courses. The Pioneer Library and more actually hosts, like, I think, a yoga class once or twice a week. That's a great opportunity for people to come out, engage in their community and move their bodies without, you know, worrying about, can I pay for a gym membership? Cooking classes and things of that nature. It really addresses the whole person in all of their needs. And the third would be hosting resource fairs. I mean, resources for financial literacy courses, help with filing taxes, where are your food pantries at, just having a day and a time, whether it's once a year or once a quarter, that people in your community can come and talk to all the different resources in your area and get all that information at one place at one time, instead of having to go to 3 locations. Karen talked a lot about some of the unhelpful policies. I have the third one, and I know this is a controversial one, I know, within the library system, but late fees. I feel that they can be a barrier to people, especially if my book is 2 days late, I know I don't have the money to pay that, so I'm really not going to take that book back. And it's going to sit there even longer because of the fact I know I don't have the money to return it. Not only that, now I'm never going back to the library because I'm worried about what's going to happen when I bring that book back. What's going to happen when they tell me, oh, this is like 280 days late, so you owe us X amount of dollars. It just creates a significant financial barrier for so many people to a place that's supposed to be free and accessible.
Okay. Yeah. Yeah, we've been working on eliminating fees in my system, I have to say. We don't have very many of them left. And there's definitely been times where I just let people know, like, we can work out a payment plan. If you need to bring me a quarter every time you come in until like the $2 DVD late fee is paid, like, I'm okay with that. Because there's not anything I can do about that one. Like the fees that, we've gotten rid of the fees we can, and then ones that, it's higher up than me, but just like working with people. but then, let's see. Yeah, I was gonna mention like the sleeping one, just seems really weird to me. Because yeah, some people just need a place. So, you know, we always say like we're open, you know, people don't have to pay for anything when they come in. So people are going to come in and just let them do their thing. Something else that I worked with my grant initiative was just getting some supplies to just kind of hand out. So I just have like a little basket. It's like on a little bottom shelf that has like some deodorant, you know, since no one has a public shower, the least I could do is give out the little like travel size deodorants to people or little bars of soap or something, you know, just to kind of, help people out. And then some people will see it and then they'll donate some, you know, things that they have. So it becomes kind of self-sustaining.
So your basket is very visible to the public, like they can just help themselves, or do they have to come up and ask for it?
I don't know. It's just sitting there. I only put like a few items in at a time, so I have more in my office. But yeah, it's just sitting there.
Excuse me, I have to change rooms, so that's why I'm fussing around. Please continue.
Yeah.
No worries.
But yeah, just a little basket and people can come and get. At first it was just, I just did like little bottles of water, which I also thought was just really helpful in the summertime.
Yeah.
Because I will say people talk about how, you know, oh, you shouldn't have to wonder about water access. But yeah, the free water, like, yeah, we have a fountain across the street from the library that's like the sulfur fountain. So it tastes like sulfur. So yeah, people swear by how healthy it is, but most people also say that it doesn't taste good. So handing out little bottles of water so people can be hydrated in the summertime went a long ways. So.
Jennifer, have you found any grants or funding sources within your organization that have helped you sustain that? Because I know it can be hard for people paying out of pocket to offer those to the public. So is there any, and maybe programs within your organization that have helped with that?
No, not really. I mean, like I said, I just had the one initial grant and I just bought like a big stockpile off of Amazon.
Okay.
Because if you Google like it's like, I do like toiletries for charity or something, you can get like huge packs of like in bulk of just a lot of different supplies in one big box. So yeah.
Toiletries for charity, is that what you said?
Yeah.
And that's complimentary?
No, we had to pay for it, but it was a whole lot less than buying individual ones at Walmart.
Yeah. Okay. Wow, this is great. Okay. So I'm going to move on to my next question. How can libraries get the word out about what they offer to those in poverty, and what are ways to reach those in poverty?
Sorry, I just had to get to that. Yeah. I'll go ahead and start. I think the biggest way to get the word out is word of mouth. Social media and flyers can be effective, but oftentimes people who are in poverty have limited access to social media. Word of mouth is just the most significant. So just be mindful that when you help one person, they may know 5 other people who need help with resources. So making sure that everyone in your community can be aware that you offer resources and services, and disseminating that information publicly. So whether it's through signage, whether it's through word of mouth conversations with the people you assist, just say, you know, hey, I help with other resources. So if you or anyone you know need help, please send them my way. It goes a long way with helping. I worked at the regional food bank before I moved to Parent Promise, and I did resource management on a daily basis. And the biggest way I had people who would come and access our services were, hey, my best friend or my cousin or my mom told me that you helped them, so they told me to come to you. Just making sure you're having that conversation with them and knowing that you are as low barrier as possible. And then I highly recommend partnering with local resource centers as well as food pantries. having that personal relationship and connection is huge. That's actually how I'm on here with you guys today, is I have a strong partnership with a librarian at the Moore Public Library. And when I was at the food bank, we worked hand in hand pretty often. And she would email me, hey, I know of a family that they have a teenager who's going to be home all summer and they don't get lunch. What can we do? Or, you know, I had this mom mention that their SNAP benefits ran out this month. Can you tell me what procedures or what they need to come and see you so I can help her? Just things like that, having those partnerships in your community and with other nonprofits in your area is going to be huge to serving.
Yeah, I believe in the partnerships, especially in, well, I don't have experience in rural areas, but from what you're describing, but you can partner like with legal aid, the food, clothing, rent, utilities, partner with faith-based organizations. A lot of times they can provide things that others can't. Partner with schools, connect with those in the community who are planning events. So if somebody's planning a job fair or something, can the library have a presence there? That type of thing. So yeah, it's all about connections.
Yeah, so I work in Sulphur, but I don't actually live here. I've only been here, 3.5 years now. So one of the things I was really running into was that everything is just word of mouth. So it's like, if you know someone who knows someone who knows something, there's this great resource. But if I just had someone walk into the library and say, hey, I'm struggling with food, where can I go? You know, I didn't really have a response. So that was part of my grant project, was just to put together a little pamphlet that just lists what is actually in Sulphur. I called it Finding Food in Sulphur. And I just list that, you know what, there's this senior center. So if you're over 60, you can go there and get a free lunch any day of the week. If you're, you know, we have a food bank where you can pick up like a grocery cart of food, you know, once a month. And here's kind of the requirements and here's the contact info. And just running through all those different options and then leaving it out for people to pick up when they need it. Not that a ton of them have been picked up or whatever, but it's like, it's there. So now I don't have to stumble around like, well, I think this church is offering something nowadays, or they're offering vouchers or whatever. It's there. Like, there is a place for people to actually start. And it doesn't have to be really fancy. I mean, I had a grant, so, you know, I made, you know, I put color on it and stuff, but it's really something that, you know, if you've just got a printer at your library, you could print something up and just have it ready for when people come in. I tried to get a list of some of the other services in town, and that's when I realized that there aren't a whole lot of other services. And so, you know, but I have a list that I have behind the desk now of kind of, you know, if someone's struggling with addiction, or they're struggling with mental health, like, I at least have started keeping a list of where things are so I can point people to them. I've also struggled with the fact that our nonprofits might be doing great work, but they aren't necessarily good at marketing it themselves. So reaching out to them and seeing what library resources I might be able to offer them to help them with their marketing. You know, letting them know that if they have a flyer for something, like, they could design it and they could come print it at the library if they need to, if they don't have printers. And doing stuff like that to support the nonprofits and what they're doing, I think has gone a long way. Like, right now, the deaf community is also a big part of Sulphur. So, like, I'm offering a free ASL class, which doesn't, you know, part of that's reaching out to the deaf community, but it's also like, if a deaf person loses their job and needs help, like, they need somewhere to go to. And the places we have around here are not the most accessible. So providing support for those things that's kind of where our partnerships have kind of headed, is that the library is trying to support the nonprofits we have to do what they need to do.
Are there certain community organizations or places that offer regular services you would suggest partnering with? Any specific organizations you want to give a shout out to?
This is just going back to my roots with the regional food bank. I'm a huge advocate for them. They have a great network. And to understand the networks across Oklahoma, the central and western portion of Oklahoma are under the regional food bank network, and they distribute to all local pantries. And then the eastern part of Oklahoma is covered under the community food bank of Eastern Oklahoma, I think is how it's correctly termed. And they distribute to all local pantries in Eastern Oklahoma. So both of these organizations, if you go to their websites, the regional food bank is rfbo.org, just regional food bank of Oklahoma. So rfbo.org/gethelp. If you go to that link, and Roxanne, I can share all these with you so you can email them out to the participants.
Oh.
But you can type in your zip code or any zip code in their service area, and they will pop up a list of where food pantries, kids meal sites, senior meal sites, and soup kitchens are. So they can find the closest ones to them, and they also have the days, times that they're open. My understanding is the Eastern Community Food Bank of Oklahoma also has a similar map on their website. And I believe it is, I don't know the URL, but if you look up Eastern Community Food Bank of Oklahoma and go to their website, there should be a map there, and it will also show you where pantries are located. So if you're having a conversation with somebody and they're unsure, they're like, I don't even know where to go, you can, thank you, Roxanne, that's perfect. You can pull that up and help them find it and print it off right then. Be like, here's where they are, here's when they're open, and this is how you can get there. And then maybe you can walk through with them how to work through transportation options like bus passes or whatnot to find their way there. But that is a huge one. I also have a couple of other resources that are huge that I utilized a lot in my resource management work. Smart Start of Central Oklahoma, on their homepage, if you just go Smart Start Central Oklahoma, it says resources. And then when you click under resources, it says for professionals. Under there's an entire resource binder. So I mean, every type of resource that you can think of that somebody may need assistance paying for, they have organizations throughout Oklahoma that assist with that. So that was a huge resource for me. And I believe Central Oklahoma encapsulates most of the Oklahoma City Metro Area, extending out into Shawnee, Edmond, Yukon, and then down to Norman. But that may be more of a regional one. 211 is also great. So if you just don't know how to find a resource in your area, you can dial 211. Or if you look up 211 online, they have a website where you can also put in your zip code and what need you're looking for. Rent, utility assistance, childcare, clothing, you name it, and it will populate organizations in your area that can help with that. And then lastly, 988. I think their marketing has been pretty amazing, but as Jennifer mentioned, mental health is a huge concern for people in poverty. Like, experiencing financial strain it can be paralyzing, and it can also just make you question so much of your life. And so having a free resource where they can get free mental health assistance, literally all you have to do is put 988 in your phone and text it, and you can talk to a person about your mental health concerns. So if you're having a conversation with a person and they're like, I just feel so hopeless sometimes, like what's the point? Just be like, hey, if you need to talk to someone, you can always just text 988, or if you need to get on the computer, we can pull up some of their resources and work through them together, like finding them the correct people to help them with those problems, because we're not mental health professionals. But those are just some of the biggest ones. And again, I'll share those with Roxanne so that way you can have access to them as well.
It's amazing. I had no idea that you could text 988. I only knew about calling. Wow.
Yep, you can text, call, or go online. It's amazing the accessibility they've tried to implement with it.
Yeah.
Oh, sorry, go ahead.
Oh, I was gonna say, I've had some issues with that. Was it 211 website? Because what they'll do, because in the rural areas, there's organizations that cover like so many counties. It's really unclear when you go on there and put in the zip code here, like if something, do they just cover our county? Do they actually have an office here? Because probably only their headquarters is what's listed. So I found it kind of difficult to utilize. So that's why I started writing my own lists. But I guess the thing is, in the rural areas, just reaching out to the churches, in all honesty, has been the way I found out most things. Because we have like an organization here called Inca, and they do a lot of these social services type stuff. And they have like, I think like once a month, they have like the DHS person who comes and helps people with their forms. And so yeah, just reaching out. You have to get out of the, from behind the desk and just talk to people to find out this stuff. Also, just by having my grant and having like flyers about the conversation, I couldn't get people to come to necessarily the events. But people would mention things because people would come up and see it and be like, I don't know if I can make that. But did you know that this church gives out canned goods every like Sunday at 5 or something? So yeah, just really reaching out to the churches. I would also say from a librarian standpoint, ODL has renewed their subscription to like the Ryan Dowd trainings. Some of them can be kind of, I don't know. There's been, I think, some questions on some of this stuff, but I found it really helpful, the stuff on de-escalation, because that can be a thing when you're dealing with people who suffer from trauma, who may be struggling with addiction. They can be unpredictable, and it's not necessarily the most logical thing. So having de-escalation skills can go a very long ways.
I put a lot of information in the chat, a lot of links. I have a whole thing of statistics for poverty and, the minimum wage. If a person works 52 weeks a year for 40 hours a week, they're like maybe making 1,000 or 2,000 over the federal poverty level. So there's a lot of links there. If you want to find the poverty around where you are, you can go to datacensus.gov and plug in your city or something, and you can get your statistics there. If you're needing any of the information for writing grants or getting assistance.
Okay. So one of the next question is, are there resources you can recommend for attendees to learn more about poverty in general or poverty specific to their community?
And that's kind of what I think I posted. I just jumped the gun.
I think I did too. I shared a lot of.
Yeah, isn't that what you said?
Okay, great. Okay, so then I will ask our last question before we open up the room for audience questions. So here we go. What actionable suggestion do you have for attendees to take back to their libraries to support those in poverty?
I think just a general attitude of respect, being patient with people. Sometimes people, especially if they're have intellectual or mental health deficiency, can't articulate what they need. So you have to sometimes be very patient, being encouraging of their efforts. No, okay, we'll go through this again. Let's do this, and put your assumptions aside, because that's one of the biggest things that prevent us from fully connecting with our customers and giving them the help they need.
I have a huge +1 to what Karen said. My big thing is leading with empathy. So as a person who's experienced poverty, I think I'm able to sometimes perspective take better than maybe the average person could in those situations. But as Jennifer mentioned, a lot of the people living in poverty have experienced significant trauma because of their circumstances. And the way they react to what may seem like a very normal interaction may feel very exaggerated. And you may just be catching the brunt of 6 months of stress from them. And there's a whole host of reasons why. So leading with empathy and compassion, and just remaining curious as to how you can help them is going to make a world of difference. Just continuing to seek out resources that you feel could help your community, and just shifting your mindset will ultimately help you be most successful in serving this population.
Yeah. And yeah, so I definitely third like all of that. I would also add, when you're leading with empathy, you can also look for ways to, not just yourself, but help your wider community. Because like one of the programs I did, I showed the movie The Public with Emilio Estevez, and then led a discussion afterwards about like, what did we see in the movie? Did this challenge some of our assumptions? And then also bringing in people who know, like, how is this different than how poverty looks in our community? Because like one of the things that's not really in the movie is that most of the cast is male. Whereas in our rural communities, you will see a lot of women. You'll see families struggling with these things. So coupling it with a discussion to like point out those sorts of things is really helpful. But yeah, just coming up with the programming to kind of just break down some of those barriers and help people see like, oh no, we're all neighbors.
Thank you all so much. So it's time for audience questions. Does anybody have a question for our panelists?
I have a question. And maybe this is for Karen. How are you funded? We've looked at getting a case manager or somebody embedded into the library. There's not. We're going to have to fund that. And has anybody found resources for grants or something like that for funding that?
My position is funded through a grant through the Zero Family Foundation, and this was done a long time ago. I don't really know how it was brought about or whatever, but that's where my position is.
Okay.
And some library talk is like hiring social workers or case managers as part of their staff. But if you can partner with an organization, it's better, because social workers and case managers have to maintain their accreditation. They have to have certain trainings. They have to have, certain supervision and stuff. So if you can partner with the agency who could provide that, like with DHS coming in to help fill out forms, that's huge.
So does DHS also provide other resources, or is just what DHS provides? Do they assist with tribal resources and religious resources, etc.?
Not to my knowledge.
Okay.
Yeah, not so much. And I would also say with DHS, if you're in a rural area, since DHS has closed so many of their offices, because like, for example, Sulphur is the county seat, and we no longer have a DHS office. Like, it's only a regional one that's all the way in Ardmore. Yeah, so what I found is look for other organizations trying to fill that gap, because what I found is that at the health department here, they have, they've been hiring like equity officers who people can contact and set up like one-on-one appointments, and they will sit with someone and help them get through like filling out DHS forms. And they're also more open because it's not really exactly under their like health department purview. They'll look a little more into like tribal resources or church resources or whatever to, you know, just help somebody out. So looking for kind of, yeah, some of the other offices I've had a little more luck with.
Ideally, what I think we would like to do, we have several organizations here in town that does provide case management and counseling services. And what we would like to do is be able to subcontract them to send somebody in on very specific days. So we know every week they're going to be here at this time. So it can be a very, something stable in people's lives who don't have a lot of stability, that they know that somebody be there at a certain time.
Any other questions?
Yes, I'm sorry. Norman, I think it was Norman at one time, I had heard that they did like a day where they had a lot of organizations together and people could get their social security card and apply for their driver's license and all of that. And they kind of did it at a park, I think. Have you guys ever been part of one of those or something like that? And so where do you start? Because I mean, that is a big hurdle for anything if you don't have some type of identification. No.
And that's really hard to get to because you have to have a birth certificate, or even for housing, you have to have a birth certificate. And if you moved around a lot, you might not necessarily have that documentation, or you need the money to get ID. You know, whereas in Tulsa, we have some organizations that can assist with that, but I don't see that as just everybody having money for somebody to go get an ID. It's a challenge.
With our birth certificate, you gotta, you know, you want it mailed somewhere.
Mm-hmm.
Excuse me. And then you end up, okay, where do you mail it?
Exactly.
We can have to some extent stuff mailed here, but we really don't want to be highly responsible for stuff.
I
Yeah.
think the best way I've seen it done is there are multiple food and resource centers across the state of Oklahoma through the Regional Food Bank Network, and oftentimes they are hubs for community partners. I will say this is going to be a much more difficult battle in rural areas where there's not as much flexibility or as many resources, but a lot of those were resource fairs where people pull together and say, okay, we're going to organize a day where we can all get to one location at the same time and make it as accessible as possible. For things such as driver's licenses, social security cards, birth certificates, I believe it was just a conversation with that office and asking, what can we do to help facilitate this here at this location? It would just start with a conversation. I would recommend, if you're interested in seeing how you can approach that, there's a couple of organizations that do it here in Oklahoma City, so they may have more understanding. One is Upward Transitions. They assist many people experiencing homelessness in Oklahoma City get their ID. So they may know more of what you have to do logistically to make that function. Another, I believe, is the Homeless Alliance. And they will help, I want to say it's either birth certificate, driver's license, or both. But I would need to look more into that one. Upward Transitions, I know 100% they help with driver's licenses. So they help facilitate the process of applying, covering any fees, and then having it mailed to them. So if you're interested in how that works logistically, that's who I would reach out to.
Ada has developed a task force, and they have a Ada resource list, which we found it's just been developed in the last few months. We found it very useful. It's something the library has tried to do, but we just don't have the manpower to keep something like that maintained. And it's something that's been very helpful for us.
All right. Okay, so if there are no more questions from the audience, unless there are, we will go ahead and wrap this up. Thank you so much, Jennifer, Karen, and Raegan, for joining us today. If you'd like to attend our next session, it is February 8th on improving elderly care. We will send you an evaluation link, and I will share Raegan's resources that she will share with me. So thank you all so much for coming today.